And this is different than anything, any clinic around.
Workouts that are tailored for her, and that really makes a difference.
Really personal. I've gotten way more mobile, stronger, flexible. Just everything just improves me to the next level.
Welcome to the On Cue Performance Therapy Podcast, where we push sports performance and physical therapy to its apex. We change the game by bringing together the brightest minds in the field to offer best practices and question how things are done today. I'm your host, Mike Quintans, physical therapist and expert in sports orthopedics. I'm living my dream and opened a clinic that unites all elements of sports medicine under one roof to drive recovery and performance outcomes. What's happening, Performance Therapy Nation? My name is Mike Quintans, your host of the On Cue Performance Therapy Podcast. Today, I'm joined by Dr. John Luksch. Dr. Luksch is a primary care sports medicine physician who is currently employed by the Rothman Institute. Today, we'll be discussing a few hot topics in the field of sports medicine, including overuse injuries in youth sports and the psychological and social impact of these injuries. But first, I want to take a moment to thank you, our listeners, for listening, sharing, subscribing, and showing the podcast some love by subscribing and leaving 5-star reviews. Dr. John Luksch is a board-certified, fellowship-trained primary care sports medicine physician who specializes in the treatment of musculoskeletal injuries in athletes. His clinical interests include overuse injuries in young athletes, sports-related concussions, musculoskeletal ultrasound, non-surgical treatment of chronic injuries, and injury prevention. During his fellowship, Dr. Luksch served as a team physician for several high schools and still does, as well as colleges and professional teams, including the Philadelphia Union of Major League Soccer. He is a published physician with numerous professional memberships focused on sports medicine. Dr. Luksch is focused on helping patients manage their acute and chronic injuries so they may maintain active and healthy lifestyles. Dr. Luksch practices with the Rothman Institute in Malvern and in Glen Mills, which is located in the Philadelphia suburbs. What's up, Doc?
What's up, Mike? Thank you for that very lofty introduction there.
Listen, lofty introduction for someone who deserves it. You know? we don't give out those intros for everybody.
Well, thanks for having me, man. This is great.
Yeah, I'm happy to get you on. We've talked about, we're good buddies, and we've talked about doing this for some time now, and I'm eager to pick your brain on a few of these topics. The overuse thing, to me, we haven't really spoken that much about but that's sports medicine and like youth athletes. Like that's where we're at right now. We see a lot of it, especially in this clinic. So tell me what you're seeing. So we're like right in the middle of COVID. Like what are you seeing in the office?
Yeah, so it's an interesting time, right? Because with a lot of youth sports from the school side of it, right? COVID hit March, late winter sports, spring season's really compromised. You know, school's off in the summer, but as we've gotten into the fall, right? Some fall sports are coming back, others are not. It's varying by district, even within districts and leagues, it's varying by school. So it's not uniform. So that's been kind of a hang up for a lot of our youth athletes, because for some of them, that's all the activity they do. Whereas you have other youth athletes that are also involved with club teams, and the clubs have kind of continued to maintain some activity level.
Why is that? Is that a liability thing? Like why is club soccer allowed to play, but high school soccer?
They're not beholden to the same restrictions. I guess, like the school district's part of the state, and so I guess from that standpoint, it's more that the clubs don't have to adhere to some of the same rules. Now, like the universal mandates like distancing and masks and
sure. They're abiding by all the
not
rules.
Being sick and temperature screens, right? Like stuff like that. Obviously, they're trying to all stick to, but in terms of limiting, practice time and game time, a lot of them don't have those same kinds of restrictions that they must hold fast to.
Yeah, and you're seeing the same thing with high school. Like even high schools, the private schools, at least in this area, are back in school right from the jump in September.
Right.
and now we're in October, and that seems to be like now the public schools are starting to see how things went,
Right.
For the private schools and implementing their own patterns and ways of getting back to school and sports.
All right. So some school districts, they're starting to make schedules. They're starting to have practices. Winter sports are kind of taking their lead from what the fall sports are doing and planning their seasons, whether or not they go off as scheduled or delayed. Obviously, that'll remain to be seen. But yeah, all through this, the club sports have never really stopped. And so kids who play soccer for their high school team, their fall season is maybe on hold or delayed or postponed indefinitely, but their club team never stops. So they've been practicing with their club all through the spring, tournaments all through the summer, tournaments now. Same thing with sports like baseball, field hockey, lacrosse. Like a lot of that stuff never really died down from that standpoint. So
you're picking up in the clinic. Like, are you seeing? So because now you don't have. Do they? I shouldn't assume. Do these club teams have athletic trainers or some kind of medical staffing?
Some, I'm sure, do. It might be the tournaments in which they participate employ like a per diem athletic trainer, or the facility in which these tournaments are being held might have an employed athletic trainer or a group that they contract with, so that there's some coverage on site. Yeah. But that's a great question. I don't know if all these clubs have somebody that's with them for all their practices, for all their games. So,
and that would be a way I would imagine for you to get athletes in the door would be, you have relationships with schools, obviously, but also with athletic trainers. And if those athletic trainers aren't currently working at that school, you're not going to be getting those athletes in the door as much. So probably a little bit of a dip. Is it picking back up?
It seems to be. I mean, not quite to the level that you'd expect for the fall, with fall being traditionally the busiest time of the year for sports medicine physicians because of the number of patients coming through and typically the event coverage that we are responsible for.
Sure. So Rothman's a huge orthopedic organization,
right?
And because of that, you have different points of contact all over the region, and not to mention you're predominantly in Malvern,
correct?
2-3 days a week. So Malvern, for our listeners who aren't from the area, or if you're from the area and don't know Malvern too well, I feel like Malvern's like right in the middle. It's right by King of Prussia. It's right by. It's from the turnpike's right there.
Exactly.
So it's literally 5. Isn't your office like less than 5 from the turnpike?
Yeah. It's right less than 5 from the turnpike. Route 202, which is another major highway, is literally right there. We can see it from inside the office. You have Route 30, which is another main
Lancaster
business
Avenue,
highway, right? So yeah, it's very central. It's very easily accessible. And it's a continuously growing area in terms of population. Sure. So yeah, there's people in the area, and normally in the fall, those people are playing a lot of sports and doing a lot of activities, and unfortunately getting hurt. But we're there and we're able to help and provide care for them. And the numbers that we're seeing now are kind of similar to what we historically see around this time of year, although not quite to the same level that you'd be accustomed to seeing.
So tell me about the athletes you're seeing, and I know we spoke before. You're seeing some osteoarthritis, I think.
Mm-hmm. So there's a mix.
Yeah. So tell me a little bit about like your mix, and I want to dive into a few different things, but tell me about the mix.
Yeah. So some of what we're seeing is your standard kind of wear and tear arthritis in patients. Some of what we're seeing is you have folks now who are quarantined, who are confined to home or working from home. So now they're not going to the gym. They're not working out at other fitness centers. They're not doing a lot of the things they were doing previously in terms of exercise. So they're doing other forms of exercise, maybe that they're not accustomed to, particularly people who figured, well, quarantined, this is a great time to start running. What if you don't know how to run or have the endurance or the proper form, right? You're going to hurt yourself. Just like same kind of thing if you're going to start doing CrossFit or you're going to start doing yoga or any sort of exercise modality. if you're not instructed the proper way, you put yourself at risk for getting hurt.
Or no instruction at all.
Right, exactly.
Right? I mean,
exactly.
And that's a great point. I think that's something at least that CrossFit and other organizations have, is somebody to guide
Right.
Your therapeutic activity or your whatever you're doing, your strengthening, your endurance running. A lot of people are listening to YouTube videos or like the Peloton or stuff like that. Like, who's there to tell you, you should pump the brakes on this? Or, I mean, that's concerning. So you're seeing a lot of that.
We're seeing that. And then we're seeing too, some of the athletes that never stopped doing what they were doing during the time of COVID, maybe just doing it more because they have more time on their hands. So that's another kind of small demographic.
So what's interesting about what COVID has done is I've noticed there's more athletes. All right, so there's fall ball, right? For whether it's baseball, lacrosse, like all these spring sports. But I feel like all the spring sports are happening in August or September, like, and have led into. So I have an athlete in particular. She's doing rowing right now. She's doing basketball right now. Right? I have another athlete that's doing lacrosse and soccer at the same time because they play a fall and a spring sport. So like, are you seeing any of that? And what are your concerns with playing two separate sports at the same time, like dance and or Irish dancing and cross country? Talk about being on your toes a lot. So yeah, I'm curious what you're seeing and how it relates to
we are seeing some of that. Kids who play multiple sports year round, that because of the advent of like club and travel and stuff like that, there's never really a true off season. And a lot of times these are overlapping, right? So you've got kids who are doing multiple activities at the same time, sometimes the same day, if not multiple days a week, where they're doing both activities, both sports. And you're seeing, I feel like, a higher incidence of injuries in those kids.
You can't go, cut me off if you think I'm wrong on this. You can't go from a sedentary, relatively speaking, or more sedentary, right? I said this the other day, like, what are step counts? Like, I would love to do a study on like their, like, you know, like your watch, like that has like a step count. Those have to have gone down, and like kids under the age of like 18, right?
Oh, I'm sure.
So if that's the case, and now you're playing two sports when maybe you weren't playing any sports, or maybe you were at least walking around school, and now you're just sitting behind a screen,
right?
Because most schools in the area, the average kid in the Philadelphia area, greater Philadelphia area, is sitting behind a screen doing school right now. So you go from that to practice for one sport and then practice for another sport, and you haven't walked around at all, and maybe you slept in, maybe went to bed late. To me, that's concerning. So these kids are going to get, I mean, unfortunately, it's a matter of time.
Right. It seems like a setup for a bad outcome.
Yeah, well said. So what type of injuries are you seeing in some like overhead athletes? Or lacrosse counts as that, baseball? Yep. What kind of stuff are you seeing?
So we're seeing a lot of overuse shoulder, overuse elbow injuries. Saw a kid today, baseball pitcher, really bad shoulder mechanics because he's pitching, a couple times a week, and he's also playing basketball with his buddies and was swimming all summer long. So, you got doing a lot of similar types of activity, even though they're not necessarily doing the same sport every single day, doing it most days a week, but they're doing very similar activities.
Sure.
So I'm sure you see this too, right? Sure. Like people who fall into similar movement patterns and they end up, injuring one part of the body because they overuse and overstrain certain areas while understrengthening other areas.
Sure.
Creates an imbalance, which leads to injury. So
walk me through, if you don't mind. It can be this individual or anyone else, like a picture like that. I think our listeners should know what you're looking at when they walk into the office, and then what the game plan can be given their status, their current status. And right now it seems like, if Tommy can play, he's going to play. Like, how soon can he get back? Like, I feel like the sense of urgency to compete hasn't changed with the parents.
Right.
From my side, at least.
Right. And it really doesn't for us either. But that's our job then, to kind of protect the athlete from themselves in a sense, right? And also to kind of educate them, educate family, educate coaches about the importance of strength training, proper strength training, right, to develop other muscle groups and other parts of the body, cross training in terms of activity, adequate rest, right? Like, in baseball, one of the big, pushes in recent years, especially from like the youth level, has been pitch counts and not pitching on consecutive days, allowing for, a certain number of days between pitching.
They don't play catcher. Sometimes they're not allowed to play catcher. There's so many innings they can play catcher or something, right?
Right, exactly. And the idea of, well, if you're, a 12, 13-year-old kid, why are you throwing sliders and curveballs? Like that.
Sure.
So not only, the amount of activity within their sport, but also, subtleties with the different types of activity within their sport, such as that. So, we're trying to be really diligent about looking at them, from a mechanical standpoint. Are there certain things about posture, flexibility, range of motion, strength that's all, asymmetric one side versus another, or, upper body, lower body, such that these kids are putting themselves at risk for overuse injuries to the upper extremity. Now, obviously we're talking about, baseball pitchers, but you could see this in lacrosse players. I've seen it in a lacrosse player. I've seen it in basketball players. I've seen it, in the lower half of the body, the lower extremities, in runners, soccer players, field hockey players, right? So it's not limited to one sport. It's not limited to one gender. It happens
that's a great point.
All sports, boys, girls, older teens, young adults. I mean, these are growing, developing kids, and they're, going to continue to grow and develop. It's part of our job is to make sure that what they're doing is being done safely, so that they're not impeding that growth and development.
You mentioned posture, and I feel like when someone says posture, and they
absolutely. I'm pretty sure I just did the same thing.
But and I'm with that 110%. The posture is super important. But when I hear or say posture, I don't mean like the manner in which you're like sitting right this minute.
Right.
I mean like you're set up during the day. A majority of time that you're spending in a day at a desk, or most of the times at a desk, even if it's for kids, how long is that position sustained? Right. So if I did like a fast view video or like a fast forward video of you standing, like you're going to be moving, like you're going to be fidgety, right? Like it's normal. It's going to look that way at least. The same, but it's tough to do that in sitting when the mouse is in the same spot, the keyboard's in the same spot, the screen's in the same spot. Maybe you can shift your weight side to side, but what doesn't change is typically your neck position, your shoulder position, your hand position. So therefore, those sustained postures, low load over an extended period of time, in my opinion, can cause some serious issues, especially in overhead athletes. So now you have more virtual schooling happening right now. And these kids are going from that right to a baseball team. Right. And after they pitched 2 days ago, they're playing shortstop and they're throwing the ball like an all-star shortstop over to first base, which is just as bad for their elbow, if not worse. So like, are you seeing things like that in educating? Like how does that work?
Yeah, absolutely. And it's a good point that now we got to be more diligent about doing that for our youth athletes, because everything is, so heavily virtually based with school and the time of COVID. But you think about people even who do mostly sedentary jobs. They're behind a desk, they're behind a computer. I mean, so much of what we do in the modern world has our arms and hands out here in front of us. We're kind of lean forward, lunge forward. So yeah, you get those rounded shoulders. You get that, kind of forward posturing of the cervical spine.
We're getting
and the
standing
neck.
desks next time, Shelly. Okay. Yeah. We're doing the standing next time.
And so, yeah, you have to kind of educate people about the importance of that, right? The idea of like ergonomics, keeping things, at a proper setup so that, you can work efficiently without overstraining certain areas of the body.
Sure. How about recess? Like, do kids get recess now? I remember when I was up until 8th grade, I think I had recess for like 15 to like 20 minutes for like in the morning, and then like an hour in the afternoon. And like literally, like we were sweating when we came back inside.
Oh yeah.
Are kids doing that now? Like is there gym class? Like what are gym teachers doing?
Yeah. How do you do virtual recess? How do you do virtual gym class? Like, are they allotting time for kids to get up and run around and burn off some of that energy from sitting still?
And so you have two young boys.
Yeah.
Yours, I
I
can
do.
tell you're smiling under that
I
mask
do.
right now.
Yeah,
So
6
tell me
and
about
3.
them. Yeah, okay. So 6 and 3, and I'm sure they're running. I got 2 younger brothers, and like it was nuts always.
Always.
So tell me about like what it's like for them. Obviously, super young. Like tell me about what they're dealing with.
So
and
so
running
we're
around.
very fortunate, my wife and I, in that our kids' school is in person. So
Awesome.
they're in person. They're going all day, every day. They're following the rules and adhering to all the recommendations and guidelines from the health department and CDC and state and local levels. And so we've been like super happy and super pleased with that. But they have recess and they have gym.
Good.
And they're constantly getting up and doing stuff with their class in their classroom. So yeah, a lot of times by the end of the day, yes, they still have boundless energy, but you can tell like they've been at school all day. They've been working and running around and playing, and not just because of like all the marker on their clothes and like dirt on their clothes,
Yeah, their
and
step counts are up.
faces, right? So yeah, we've been very fortunate in that regard that they're in school, they're getting the socialization, but they're also getting the physical activity component of it.
Yeah, and how do you force your 14 or 15-year-old son or daughter like go outside and play?
Right.
Like, I'm in my room. Like, don't come in here. I'm learning.
Right. Exactly.
Right. I would imagine that's the case for most of the time. If the parents are home, I mean, they have to work, right?
Yeah.
So
Yeah.
I think this is COVID sucks on a lot of different
Definitely.
levels. Too many people have died, and it's awful. But what's the long-term effects of this beyond what we see right now with our eyes is what's most concerning to me.
Right.
We had Dr. Webner on, a little bit ago, and we spoke about some of the myocarditis, like some of that, like and what we're dealing with on that end of things. Not only now, but long term, athletes are doing different imaging for their heart, like echo. They're
Right.
doing EKGs,
Yeah.
to make sure that they're clear to go back. So I think that's there's gonna be some long term effects to this. So
Absolutely. And that's one of the scariest things about the current situation we're in is that we don't know a lot about the downstream effects of what's going on. So one of the schools that actually both of the schools, the colleges that I take care of, part of our policy for return to play after testing COVID positive is cardiac evaluation and clearance.
So how are you doing that? Are you referring that out? Are
Yeah.
you doing that yourself?
Yeah, no, we're referring
Okay.
that out to some of our consulting cardiologists, but with the expectation that they're examining these athletes, they're getting an EKG, an echo, potentially some blood work. If they feel it's indicated, an MRI, a cardiac MRI. I mean, there's like a battery of tests that our athletes are going through, because we want to make sure that there's no concern for myocarditis or pathologic arrhythmia, that whether you're 18 or 21, yeah, technically you're an adult, but you're a college student, you're a college athlete. Like, these are people's kids that if they're going to play sports, they're going to do it safely because they're under my care. And I want to make sure that we're not, overlooking the fact that, these are still kids and they need to be watched out for. So we want to make sure that if they're going to go back and do this, they're going to do it safely. There's not going to be, the potential for something like myocarditis to happen. And so that's been our stance.
That's got to be that's got to be tough on a lot of different accounts. But like, so what's your role in that type of case? Were you consulted in on it? Like, okay, what battery tests do we want to make sure they get, or do we want to make sure they see a cardiologist? Obviously, like there's other routes they can go to. They can obviously be working with the athletic trainer. There's rehab protocols out there now for return. Let's say they found something on the test, and now they need to do a cardio rehab, essentially. An 18-year-old, that's wild to think about. That's a college athlete would have to do that, but that's possible.
Right.
Are there's protocols in place in some of these schools?
Mm-hmm. Yeah, and that's part of like the COVID action plan for athletes who are positive.
Wow. So at these schools, are sports coming back are they back? Are they coming back? Basketball at Immaculata, I know is huge. I have a buddy that played basketball there.
So
and I know the
so we're
women's
waiting
team.
to hear on winter sports. So the fall sports postponed indefinitely. the spring sports have their non-traditional seasons. There's no competition, right? So there's no fall ball tournaments. There's no travel. There's no games. It's a lot of just practices and workouts. So that's gone on. But in terms of like actual like games and competition, no, that's still
I feel like
on hold.
I feel like everything is week to week right now. And I know like the Central League just passed, so that's like, your Pancras or Radners.
Yeah.
They just passed at least like they're going to practice. I think it's like 2 to 3 weeks, and then they're going to start competition, I believe.
Right.
Shanahan, what do they have anything in place
So
right
they
now?
are in the Chessmont. They do not. They do not. They made the decision not to participate.
Okay. Yeah, that's tough, man. I feel bad for some of these kids, and they didn't find out until now.
Right.
So you have these kids who are going into their senior year or in their senior year.
Exactly.
And they're hoping to get some film out there. And
Right. And that's another one of these, kind of unmeasurable, side effects of the current situation is, what about kids like that, right? Like, what about the kids who, like, they never aspired to play college football, but they wanted to play in high school because their friends play and they wanted the experience. And now, like, the whole notion of senior night and homecoming and being a team captain, to have that stuff sort of just yanked out from under you without warning, that's gotta really suck.
Sure, it does. I mean, and we talked about this briefly before we went on air. Like some of the social and emotional components to the health, right? And playing sports. So tell me a little bit about some of your experiences with that, and kind of what you're seeing either in person and how you need to tap into that.
Yeah.
Like emotional intelligence and so forth.
Right.
So, yeah.
I mean, not every kid who participates in high school sports does so with the expectation that they're going to get a college scholarship and go on to play at some higher level. I mean, some of them do it just for the socialization, the camaraderie. Like, maybe they got into it just because they wanted something to do with their time, or because it was some kind of activity and exercise for them. Now that kind of portion of how you identify and how you sort of remember that particular period of your life takes on a whole new meaning. And these kids who are anywhere from 14 to 18, I don't know if they necessarily have the emotional maturity to understand that ramification at this point. They may look back years down the line and be able to kind of come to grips with it. But I think it's a huge strain on their emotional and psychosocial well-being.
What a good point.
And
But
and the other thing too, I feel like, is if all you know is your football team and your football coach and that mentality, then that's the mentality you're going to have regarding this. But if you're somebody who you play football, maybe you wrestle in the spring and maybe you play, or in the winter, and maybe you play baseball in the spring, you have 3 different coaches, 3 different sports, right? 3 different mentalities. Maybe you're a little better equipped to kind of understand it because you've kind of learned from, different minds. You've kind of seen people handle competition and stressful situations in different fashions. That's one of the things with you have kids that specialize so young, that are doing so many of these sports. Are they missing out on not just the physical development that comes with doing other sports and other activities, but the socialization element? Because I don't know about you, but growing up, I played a couple different sports. I was never particularly good at any of them, but I enjoyed it. And
and that's what it was all about.
And I feel like the mindset of people who play one sport is different than the mindset of people who play a different sport.
Yeah.
And you might pick up some useful traits from your football team that you wouldn't necessarily pick up if you just played lacrosse all year round. And I'm not picking on any of these sports in particular. It's just that the idea of like being able to experience different sports allows you to interact with different people and be exposed to different styles and mindsets, and you kind of take from that what you like, leave behind what you don't, and that's part of what helps you form your own outlook on things.
Without a doubt.
I remember in medical school, right, you do your clinical rotations through all the different specialties, and you work with all these different doctors. And yeah, I might not want to do psychiatry or particularly like psychiatry, but if the psychiatrist I'm working with has a really good way of putting people at ease so they can have a productive conversation, then maybe that's something you take from that and you learn, you know?
I mean, that's what we are as human beings. We're wired to do that. We're wired to pick and choose traits and try and mimic those traits, right? I mean, it goes all the way down to, infancy. So I can say the same thing as a physical therapist, that I've met with different physicians that do different techniques, or how they talk to somebody and shadowing and so forth. So if our kids are that's taken from them at a time where that's so vulnerable, like the maturity, at least for a male, I can speak from that perspective, from the age of 16, even 14 through like 22, 23, like that's where you develop your maturity.
Right.
So if some of those influences are either taken away from you, or you don't seek them out because you want to specialize in one sport, I think that can be a negative thing. Yeah. So all right. So I'm going to pivot a little bit. So if we're going to go into specialization, I kind of want to know about what you're seeing with some like different like elbow pain, shoulder pain. You mentioned apotheosis earlier. That's something I see a lot of in the clinic. Can you tell us what apotheosis is? Mm-hmm. And then from there, how would you look at it in the clinic? And then how do you manage it? Because it's right now, I see it a ton, especially with youth baseball and other sports.
Yeah. So the apophysis is an area of the developing skeleton where muscle tendon attachments occur. So in a young, developing, growing athlete, these areas of the skeleton are open. They're the site of attachment of different muscle groups, right, where the tendon specifically will attach throughout the skeleton. But because they are still open, they are the weaker points of the kinetic chain, right? So instead of getting a tendon tear or strain like you and I would, because, we're fully grown adults, or at least
that's what we
like to say we are, they'll get potentially inflammation of these areas, or they can even avulse them, right? Pull them apart and have fractures through these areas. So thankfully, I haven't seen many apophyseal avulsions lately. I've seen some, more apophisitis. So kids who have either repetitive use with like a sudden forceful, contraction of a muscle group, or I've seen some that have resulted from trauma. You can x-ray these kids, right? Growing, developing skeleton, right? It's always a good idea to x-ray the opposite side just to make sure what you're seeing on the one side is not normal for that child, right? Because if both sides look the same and the other side's not bothering them or hasn't been injured, then that just might be how their skeleton appears on x-rays.
Like elbows primarily, like shoulders,
so elbows, shoulders, knees, heels, even hips, right? The bony pelvis.
Sure.
And then a lot of it, in terms of management, rest.
Right.
Rest, right? Remaining out of or away from the offending activity, kind of doing things to offload those areas. So whether it's protected weight bearing, non-weight bearing, brace, sleeve, sling, right, what have you, just to kind of help offload the area before you then get back into, simple stretching, mobilization, and then ultimately return to sports.
So what are you seeing? Like, typically, is it mechanical? Is it purely just overuse? Do the mechanics, I guess, drop off because of overuse?
It could be.
What do you see?
It could be. It's tough to say for sure if
Sure.
that is definitely what's happening, where you're having somebody who just continues to do the same activity over and over, and that leads to poor mechanics, or if they have poor mechanics from the beginning, then they use it over and over, and that's what leads to the injury. Either way, you have to evaluate the mechanics of it. So whether it's, upper extremity, like a shoulder or elbow, looking at their shoulder range of motion, looking at their core strength, looking at their hip flexibility, especially pitchers. Like this young man I saw earlier today, he's a pitcher. if your hips are really tight and you can't rotate your hip enough to generate power from your leg and your core is not strong enough to keep you steady through your delivery, you're gonna put more stress on your arm.
Sure. Absolutely.
So whether it's the shoulder, whether it's the elbow, shut them down, fix the flaws, and then build them back up.
Yeah, and that's there's those three phases right there: shut them down, fix the flaws, build them back up. I mean, they each have their own challenges.
Sure.
Identifying the flaws can be a challenge sometimes. I mean, athletes, they're athletes for a reason. Some of these higher level athletes, they move well, so they compensate well.
Right.
So this kid may look like awesome when you see him, throw a pitch on a video that he threw yesterday, and then you look at his mechanics and you look at him do a lunge. Like, I love doing a lunge matrix, so I'll have him like lunge to the side, and then come back and like stick the landing on one leg, right? So they go into a march. And they do it forward and then backwards and then the opposite leg. And how do they tolerate accepting weight right back onto their stance leg in a march position for pitchers? I like it a lot. So if they lean to the side, well, what's happening when they're on the mound?
Right.
If they're leaning off to the side on the leg that they're pivoting on, then what happens to their slot? It changes. Right. And then the force is going to be transmitted differently. So, I mean, it could be the ankle. Maybe there's an issue. Maybe that ankle, they sprained that ankle playing basketball 2 weeks ago, and then they pitched 7 innings yesterday. We're seeing that happen now. So you got to look at, like you said, you got to identify, you got to watch them do the movement. So are you able to do that in the office, or how do you go about doing that?
Somewhat kind of cursory, right? So you got to check, obviously, range of motion of the affected joint, but you also got to check, joint above, joint below. For pitchers, any kind of overhead thrower, I'll look at their hip range of motion, right? I'll lay them down. Awesome. I'll check their hip. I'll look at their, how tight is their iliopsoas, how tight are their quads, how tight are their hamstrings, do they lack rotation on one side versus the other? Your Trendelenburg sign, right?
Sure.
Are their glutes really weak? Right? Yeah. There was a physical therapist that I worked with as part of my fellowship training. He used to call those folks butt dumb, right? Are they butt dumb? Do they have weak glutes, right? Like you said, do they have good truncal rotation, forward flexion and extension? Can they side bend well? Or are they restricted? So we can do some of that, kind of cursory eval in the office, but more dynamic types, evaluation and things like that. That's really where someone like me relies on somebody like you.
And that's the communication piece with the whole thing, is what you're seeing. Like, I'm not sure off the top of my head how long you would shut down someone with an apotheosis of their throwing elbow, if depending on maybe how large the gap is, or maybe they can still throw, but they can only throw from second base, right, and or only play first base because they can still hit. That's your decision, unless pain's increasing as this is going on. But nonetheless, I think that's where our two worlds meet. Obviously, you're educating with the shutdown period. How long typically, depending on the severity of it, there's different levels of this type of injury. But for the average injury, they're getting back in how much time? And then tell me about the build-up phase. And then when do you clear them? Do you expect the PT to do it? What's your take on that?
So for me, usually, for throwers, right? For me, usually it's a minimum of 6 weeks. Minimum of 6 weeks. Yeah. Because I don't think if you just shut them down and say, okay, and as soon as your pain's gone, start throwing again, well, a week later, they're going to go back to throwing, and they're going to be okay in the beginning, and they might feel a little sore, but then 2 weeks later, they're going to be hurting again, just like they were when they first showed up. So I think I shut them down for 6 weeks, number one, because that allows for the inflammation of the apophysis to subside. But number two, I feel like if you do it for any significantly less time than 6 weeks, how good a rehabilitation are you going to get out of them, right? Like how much are you really going to be able to identify what's wrong in the kinetic chain and fix it?
Strength and stabilization takes 6 to 8 weeks to start to see differences.
Right.
So, you're right. Now, coordination, we can get a little bit quicker, right? But coordination isn't usually what these athletes need. They need strength, endurance, power. That takes a long time to develop, and 6 weeks you're right. That's going to reduce the inflammation and start some of these processes. and then you got to increase the load until they can pitch.
Right, exactly. And so, there's a lot of kind of standard like return to throwing progressions that you can go through. And I'll usually give my physical therapy colleagues kind of some leeway with when they feel the athlete's ready to start doing that. And then obviously we monitor for any kind of setback. But I'm a big believer that once you're cleared to return, that's not the end of your work, right? It's not like I did PT for 6 weeks and you're sending me back, and now all the stuff I just spent 6 weeks learning how to do and doing so that I could go back, I'm just not going to do that anymore, right?
Thank you.
You got to, right? You got to stay with that. And I tell these kids, especially pitchers, right? Like I ask every single one of them, have you ever heard of something called a sleeper stretch? And most of them have not. And I'm like, okay, well, you're going to learn it. It's going to be your best friend. You're not going to like it, but you're going to do it, and you're going to continue to do it, because if you like pitching, you need to keep your capsule
loose. A degree of rotation, right? And to me, like I feel a couple different ways about the sleeper stretch, but nonetheless, it helps unless the kid doesn't know how to stretch it the right way, right? But it's you have to keep the capsule loose, especially we were talking about this posture, right? So you need a degree of passive range of motion or active range of motion into external rotation, but you need to keep up with it after you return, right? Like, all right, you did great here. You're pitching, like, all right, high five, you graduated. And this is kind of why I built like this thing on the other side of this wall. So we can allow our athletes to then transition to work with our strength conditioning coach, Jordan, is here, and actually execute the rest of that program, and then keep up, monitor, and be athletes. So that's huge.
And that's the thing that I think like younger athletes don't realize, right? You get hurt, you recover, you go back to sport. That's not the end point, right? That is a point. It's not the end point.
Sure.
Right? So you're going to continue to participate. You're going to continue to grow and develop and get into higher level of that activity or other types of activity. And you want to make sure that all the problems you just fixed don't become problems again. Because I did just see a kid, and about a week and a half ago, that I cleared to return to baseball. He's a pitcher. This is now the second time I have seen him for the same issue. And he himself, 13 years old, said like, no, I didn't keep up with my stretches and my exercises. And the dad was there, and he said the same thing. Yeah, he didn't really keep up with those.
Yeah,
they will now.
There's a degree of accountability, and I feel a type of way about this because we're seeing. I had a 9-year-old like that I treated for like a month or two with this. I mean, these are children that are experiencing these overuse, repetitive overhead injuries, and it's like why is this happening? Like what is it? Is it because they're playing shortstop? Because let's be honest. Here's my quick take on this. The kids that are pitching are typically the kids that who throw the hardest, and the kids who throw the hardest are typically playing shortstop because they're good athletes. Right. So in my opinion, not only are they pitching, or they're playing in the outfield because they're good athletes. So they're throwing the ball a good distance. So what do you do when you're that guy? So you're pitching, you're playing shortstop when you're not pitching. So you're taking ground balls in between innings, you're throwing it over to first base. You got a strong arm, so you're probably not throwing it over the top with perfect mechanics because you can rely on throwing the ball. I say all the time, like Jimmy Rollins. I grew up watching Jimmy Rollins, and Shelley, you're nodding your head because everyone knows Jimmy Rollins to come in and sling it sideways across the diamond. So that's how and then they go and they get ground balls. They're not pitching, but they're getting ground balls from dad. They're throwing it over to first base, not dropping it in the bucket, because that makes too much sense. They need to throw it over to first base. And then no, they're not pitching, but they just took 100 ground balls. And they're throwing to the first base, which might even be further than pitcher to the home plate.
Right.
And so we have to use some common sense here and not make our kids and not do this 10 months out of the year, 10 times more likely to get Tommy John surgery.
Right. And it's funny because I feel like I've had that conversation with athletes and parents too. And it's almost like you have to spell out explicitly what they are not allowed to do. And almost to the point that I tell them, especially once they get into high school, like, look, if you have to question, should I be doing this? Just don't do it. Like
my parents said that to me before.
Right. Exactly. Right, yeah. I've heard that once or twice too. But yeah, yes, you're not pitching again for another 6 days, but is throwing 100 grounders to first base really the right thing to do when your shoulder's bugging you, especially when you throw hard or when you pitch? No. Like,
right, with poor mechanics and everything else.
Right.
Yeah, it's and so Mike Reinold and his team, they're up in Boston. He would be the protege to like Kevin Wilk, if that name rings a bell, so, and James Andrews and everything they've put together.
yeah.
So like there's kind of that lineage, and I use their actually return to throwing protocol that they put together, and then from there it goes return to pitching. It's like almost like 12 weeks. Like it's a long time. And that's without pain. So it does take a process to go through both protocols to return to pitch, depending on the age group. But nonetheless, they had research that came out a couple years ago. I saw them in a conference down in, I think it was Denver or wherever else. If an athlete is throwing 10 months of the year, so 10 out of 12 months, they are 10 times more likely to tear their UCL. James Andrews he did a line of 10, 11, 12-year-olds waiting and trying to get Tommy John surgery, like on a partial tear, because they think they're going to throw harder afterwards. Right. Like he said that in the conference. Right. Blew my mind. And so that's again,
wild statistic.
It's crazy. And so, the whole thing's tough to like be a medical professional and know a little bit about it and watch it happen. So what can we, like, in your opinion, what can we do about this? Like, how can we help to educate? Like, clubs are available now, so we don't have to deal with the politics of schools, maybe. Some of us have access to schools. Right. So how can we help?
Yeah, I think it's a couple of things, right? I think it's trying to really stress the importance of varying up your activities, right? Not doing the same things over and over, allowing for a period of at least 3 months out of the year where you're not doing that activity, right? Mm-hmm. Let yourself really rest.
Yeah, and don't go swim, right? Because that's another overhead sport.
Right, exactly.
So educating on that. Yeah.
Right. So varying up the activity, resting from, doing more than one activity for too long a period of time. I think a lot of it too, you got to kind of set expectations with people. Like one of the things I feel like I never got a good exposure to in medical school was that, like, when you're dealing with patients and you're dealing with families, like, it's a lot about managing people and personality as much as it is about managing pathology. And,
so well said. Oh my
right?
gosh.
So you have to kind of learn how to talk to people and set expectations so you can understand what's realistically like going to happen, what's going to be good for people in the long run versus what's going to be detrimental to them.
That's a great point.
So, if I have a kid who really wants to pitch Division I and maybe go major league, okay, we're going to maybe have a little bit of a different conversation than the kid who, is a good pitcher, on his local, travel team, but the only reason he plays is because all his buddies are playing too.
Yeah.
So managing expectations, kind of tempering them for people so that they understand what's realistic and what's not.
Yeah, I guess we have to look at like our platform, right? Like, so we have patients, athletes walk into our doors, and we can educate that individual and hope that they transmit that message. I think getting to the coaches, now new coaches are going to come up, right, and replace those coaches. Sure. So that's like kind of like a revolving door at times, depending on the organization. Sure. But I think if you can go to like the organization and educate them, because their reach is going to be a lot greater than talking to a parent, right?
Sure.
That has one child or that child themselves. So, and obviously there can be challenges in getting to those organizations, but I think that's a good way to do it. And then offering a service is the other thing that comes to mind. Like, what service can you or I offer in our respective fields that would be like, the perception would be some type of value? Like, can you think of anything? Like, I know I'm putting you on the spot, but like, what value can you offer to this organization?
That's a really good question.
You know what I mean?
So I wonder almost like, so for our college athletes, right? Like, we'll do mass participation, physical exams, pre-participation physical exams. In that setting, we'll do, the majority of the same exam for everybody, but if there's somebody who's a pitcher, or, am I going to look at their shoulder a little bit differently than I am, maybe a first baseman, or maybe or even a second baseman or an outfielder, right? Yeah. So that's one thing. Like, do we kind of gear our examination to look for subtleties in that based on sport and position? Or, do you do like mass screenings for like a youth league or for a specific team where you get all these kids in here, you have them do maybe like a couple of lunges in different directions. You have them, look at their shoulder range of motion, maybe from a posterior approach, so you can see what their scapulothoracic mechanics are like. Do you check them for glenohumeral internal rotation deficit? So maybe there's value in something like that, where you do like a screen of that sort.
I feel the same way. This is something that we've talked about on in previous podcasts that I am like absurdly passionate about, is like identifying the best measures and tests that allow us to predict an injury of some kind, any kind, like a shoulder injury. It doesn't need to be a cuff injury or whatever, labral injury. So if we can put together these measures, and there's data out there, there's research out there. I did this with Strathaven basketball in the past, where Dr. Baxter is over there, and my buddy's head basketball coach, Chris Conlon, and like we offered an intervention that would address the deficit that we found in the screening tool, and like they didn't get hurt. Like it was weird.
Right.
Like they literally. It
had
no
seems really kind of intuitive. Obviously, there's a lot of research behind like the FMS, right? The functional movement screen. Does it really help us identify and prevent injury? Does it not? Honestly, knows. Man, like, really. I don't really care what the data says on that specific point, because in my mind, if I can assess you and I can find deficits in flexibility, strength, and motion and correct them, intuitively it just makes sense that you're probably less likely to get hurt if that's better. So when I send people for physical therapy, regardless of the issue, so if it's a shoulder that's cuff tendinosis, labral tear, little leaguer's shoulder, if it's patellofemoral, if it's Achilles, whatever it is, whatever the body part, whatever the condition, I'm going to put movement screen on the prescription.
Thank you.
Because
Thank you.
Again, it just intuitively, it seems like if I find a potential problem and address it before it becomes a bigger problem, you're going to be better off.
Without a doubt. Like I want to find screenings that are relatively sports specific. But that's going, in my opinion, that's going like above, not necessarily like, it's not a bad thing, but the minimum we can do is do the FMS. It's $100 course online. Like, come on, like we should be able to do that. And then you can at least offer some degree of an intervention to address those deficits. So they're not like you're decreasing the risk of injury regardless of the sport. So just at the very minimum, do that. So good for you that you do that. Do you get positive responses to that? Do parents ask about it? It's on the script.
Not particularly.
Okay.
Not particularly. And I don't know that in looking at, evals and progress notes, from other therapy practices, that much is made about that. But if I see this athlete back and they're doing better and I don't see them again for the same issue, that's I consider a win.
Yeah, my
right?
gosh, yeah, sure, absolutely. Yeah, that's awesome. And that's something I think we can, I don't care what, I'd love to do it with you. But that would be cool to like approach some of these organizations and say, okay, we have these 6 tests or these 10 movements, whatever, that we're going to put each of these athletes through. And we'll have a handful of like practitioners, and each practitioner does the same 3 tests, so we don't have the intra-rater reliability and all that. Right. Like, let's use some of our research logic that we've learned or education that we've learned in school and apply it. And heck, like if it's not going to hurt, like we're not going to cause any harm. So, and if we can get 5 minutes or 10 minutes in front of the family and coaches and say, listen, this is like, here's something that we see that people do wrong all the time. Like shortstop is just as dangerous as playing catcher, which there's rules for. Great. But like, how about those guys too? Or the center fielder that's launching the ball to the right fielder and then getting it back and throwing it back to the left fielder between innings. Like, do we ever think of that? Like throwing fly balls, like that's not going to cause harm to the elbow. So there's a lot of things that we can do that we can do safer and protect it. If we can prevent injuries, that'd be great. But at least educate, right? It's a minimum.
Right. Exactly, and that's what I feel like, whether as the sports medicine physician, athletic trainer, physical therapist, strength and conditioning coach, right? Like, yes, we all have our specialty training and what we do, but at the core of what we do, it's educate and empower, right? And the more you can educate people, the more you can empower them to take better care of themselves.
I love that. I think that's a good one. That's a good way to end on it. Is there anything you want to add? Anything else you want to touch on?
Oh man, no, this is awesome. This has been great.
We got to do this again soon.
I would love to. Thank you.
This has been cool. I want to talk research next time. Like, I want to put together some ideas. We were nerding out about this before in the past. So awesome having you on, man. Thank you.
Thank you so much, Mike. Great to see you, buddy.
What's your contact information? What's the best way for like patients or listeners or whoever to get in contact with you? Do you have it like an Instagram or an email?
Yeah. So the best way in terms of like appointment stuff, like to be seen and evaluated, then I would just have them call the Rothman Orthopedic Institute. Our telephone number is 1-800-321-9999. That puts you through to our central scheduling. I do have like a professional Twitter account. I don't usually post much. I usually use it just to kind of follow other sports med docs and journals, but it's at Dr. Luksch, Luksch sports. I'm a very boring, nerdy person, so I have a boring, nerdy Twitter handle.
All the great ones, all the great ones do. So that'll be in the show notes. And thanks, man.
Thank you.
Thanks for listening to the On Cue Performance Therapy Podcast. If you like this episode, please subscribe on Apple Podcasts and Spotify. It would mean so much to me if you could leave us a 5-star review so more listeners like you could get this important information. See you next time.